Dr. Preeti, and good morning, Dr. Sangeetam. I welcome you both on behalf of Team Have Me, right? And I'm very much delighted that you people took out time and like to talk about diabetes management. And I really welcome the audience out there, those who are watching us. And I would suggest that if you have any questions, so you can ask our experts on diabetes management. So I will start with Dr. Preeti on that. Over to you, Dr. Preeti. Ma'am, you're mute. You're on mute.
Thank you, Mr. Abhishek, and have me for having me on board and giving this opportunity to make more and more people aware on diabetes and lifestyle diseases. So, diabetes, along with high blood pressure and cholesterol, these are the lifestyle diseases which are happening these days and prominent due to the poor choices we make and the urbanization as well. So it's a poor choices, it's lack of exercise, and it's lot of stress, which is related to our work and our lifestyle and family issues and everything. So once the person is able to overcome this challenge of improving the lifestyle with good exercises, a very healthy diet, and reducing stress, then diabetes, cholesterol, and high blood pressure can be overcome. Now, diabetes has a hereditary component, no doubt, but that hereditary component can be sustained, as I said, with all these good choices, which are exercise, a lot of physical activity, reducing stress, and healthy diet. Now, there are many myths related to the diabetes. Now, the most two important prominent myths are: number one, if I start taking medicine or insulin, I need to take it for lifetime. That is a myth. It is wrong. For a proper diabetes management, a physician will definitely put you on the medicine or insulin because diabetes means it's insulin resistance. Our body is not able to, our pancreas are not able to produce enough insulin. So, that is a very common myth that I don't want insulin or I don't want to be on medicine because I will get habitual. The second myth is if I take sugar, I will become diabetic. Now, sugar harms people who are already diabetic, but sugar does not cause diabetes. In a proper healthy diet, obviously sugar would be limited, but having sugar does not cause diabetes. And having medicine, starting medicine, you will not be habitual for lifelong. Once you have been on medicine, your physician has prescribed you on medicine, follow other advices like reducing stress, walking 10,000 steps a day, doing good strength training. You can reverse diabetes. There are examples of that. But what we generally do, our behaviors are no, we need to see, we need to wait. But the prolonged wait and not coming on medicines will have complications on our organs, on our eyes, on heart, on kidneys, um, on feet, and most importantly, these days we are seeing lot of liver complications related to diabetes. So, starting the medication is very important. And to prevent ourselves from diabetes, the three factors which I told, they are very important. So, this is the kind of the lifestyle thing on diabetes. Uh, yeah, Abhishek.
Yeah.
Yeah.
So, ma'am, you very much rightly said that like if you have diabetes, you should start treatment. And
Yes.
we want to know more about like what are the lifestyle changes we should do, when this is the question comes from our customers, a lot of time. And we as a company are doing a lot of research out there, that what are the lifestyle changes you need to do if you want to overcome and reverse your diabetes quickly, because reversing diabetes is basically a buzzword now these days, but nobody
Yes,
knows the crack out of it, so you are an
exactly.
expert, so I would like to know from you that what are the lifestyle changes we need to do in terms of reversing the diabetes, including medicinal like treatment which we are taking.
Certainly, medicinal treatment are important if one gets diabetes, and that's up to the doctor how long they will prescribe the medicine and how long the patient is compliant until he does others. So, what are the factors which will help us, in a healthy lifestyle? See, first of all, we need to be very mindful. We need to reduce stress. Meditation, as you know, in all these apps which reverse diabetes, mindfulness and meditation. Regular exercises is the biggest stress buster as well. Okay. We also need to reduce our cortisol levels, which comes with stress. So, reducing stress, regular exercises, healthy eating, adequate sleep, okay, time management, limiting caffeine intake, limit coffee, tea, tobacco, etc. Creating, developing skills, social skills and hobbies, etc., are very good factors of increasing lifestyle socially, like with friends and families. So if these factors are taken in consideration by us, we will not only prevent ourselves from having diabetes, we'll also prevent from having bad cholesterol and high blood pressure. Okay, so these are the, yeah. In healthy eating, we need to incorporate lot of fiber in our diet, lot of protein in our diet, omega. We should not take saturated fats.
Great, great insights, ma'am. We also have Dr. Sangeetam with us. She is from Kerala, and she has immense experience in Ayurveda and Ayurveda practices. So, Dr. Sangeetam, I would like to know from you, like the same question, I'm tossing to you also, that what are the lifestyle changes basically are important? I hope Preeti ma'am has covered a lot, but obviously I would like to listen from you as well.
So coming to Ayurveda, it is called a prameha in Ayurveda diabetes. So in Ayurveda also they explained prameha with the association with the dyslipidemia or cholesterol. So when it comes to that, we classify prameha or diabetes into two, that is Stula Pramehi and Krisha Pramehi, which have more obese people and very lean people associated with the diabetes. So the basic treatment coming for the diabetes in Ayurveda is called Apatarpana Chikitsa, that is depletion therapy. And mainly it include we can do the shodhana, that is eliminating the body, eliminating different associating factors just like kaba, pitta, etc. And also which cleanses the body. Then the second method is shamana therapy, that is the elevation therapy, which include the medicines and diet control and different yoga, exercise, etc. So in Ayurveda, which treat the diabetes with a multi-pronged approach using diet modification, panchakarma, which is cleanses the body, and different herbal preparations, yoga, and meditations. So all these dietary and lifestyle recommendation is very much important. After we taking the medicine, people's thinking like that only using the medicine we can reduce the insulin, we can control the diabetes. No, nothing like that. We also need to support, or we also need to do the lifestyle changes. We need to control our caloric intake, and regular exercise is very much important to reduce the calorie in our body. And yoga or any breathing exercise or any stress relieving exercise we can do, because stress is very much important in diabetes or in lifestyle disorder. When we have stress, the free radicals are producing in our body. It will going to attack our organs, different organs. In case of diabetes, we can tell it will affect the liver, pancreas or liver, or the beta cells. It increase the disease. We need to relieve our stress. That is much important. And diet control is very much important. Exercise also very much important. It The exercise also increase our blood circulation, so it will reduce the glucose level in our body. So what is happening in diabetes like that? uh, it mainly produced due to the insulin increase in insulin production, or resistance in the insulin. So when resistance come, the glucose whatever we are taking, which is absorbed into the blood, which is stay in the blood only. It won't absorb into the cells, because it along with the insulin only body can accept glucose. When it come to resistance, so body will the glucose will rotate all over the body in the blood only. We cannot accept the glucose into our muscles or any other organs. So we need to remove that glucose level, then only we can reduce the diabetes. So that is why we reduce the calories through the medicine. They improve the resistance. Insulin started to accept the glucose, which also reduce the glucose level. And by you doing different exercises, it also reduce the glucose level. So we can control the diabetes by doing all this. And also we need to take enough water, so it will remove the all the bad things or toxins through the kidney. That also reduce the diabetes. Good sleep is enough also needed. And good exercise also is needed.
Great insights, Dr. Sangeetam, and very much thank to you. Coming back to Dr. Preeti, from the insights of both of you, uh, I am, thinking that diabetes is no more basically a disease. It's a kind of, psychological problem which is going on in the people's mind. As soon as people see that their sugar levels are increasing, they go into a kind of traumatical phase, and the stress goes up, and these stress situations increases their kind of sugar levels, and they are not able to control their whole body performance out there. Because I have seen, like, even in my family also, there are people, those who are diabetic, and they are more concerned about that which tablet should I take, or which ayurvedic medicine should I take, rather controlling their lifestyle habits, or their eating habits, or their exercising habits out there. And same thing, I think, will go to with our clients and the customers, and obviously the patients, those who come to us. So I will come back to Dr. Preeti Goyal, and ma'am, I would like to ask you one thing. Like, if a person is diabetic, in terms of lifestyle, how his or her day should look like?
As Dr. Sangeetam also said, I think the day how we should start is with lot of positivity, with a affirmation that I can control diabetes, I can reverse diabetes. The meditation part would help in that. Walking, exercise. I think everybody can take out at least 1.5 hours in the morning for that. So starting with yoga, even all the bigger healthcare centers, even Jindal Nature Cure, they make you start your day by laugh therapies, by yoga, starting with detox waters, A lot of water, as Dr. Sagitam said, is important. And then choosing healthy habits of eating. Uh, Earlier in older days, we did not have refined wheat and rice so much as what we are consuming now. So, choosing whole grains in our diet, coming back to the millets, coming back to each one of us needs 1 gram of protein for our body weight. If you are 70 kilograms, you have to start counting your protein in your diet. Whether it's vegetarian source, whether it's a non-vegetarian source, eggs are a great protein intake. So first comes the exercise. Second is obviously the diet factors, choosing whole grains, choosing protein, lot of fiber, vegetables, and using good oils. We need to keep using at least 2 or 3 different types of oils in a day. Mustard oil and desi ghee are nowadays considered better than the artificial refined oils. Mufa and pufa oils can be used. Then, if one eats fish, now fish is good in omega 3 fatty acids, especially sardines, trouts, salmons. If not, then there are vegetarian options in omega 3, like walnuts, like flax seeds. And I think Dr. Sangeetam will ask her to add more of that. By creating a positive day, if we accomplish exercise, our stress automatically reduces because we have accomplished something. Even if we should start by small goals. One should not say that, okay, I'll do yoga for entire 1 hour. Even if one starts for 10 minutes a day, walk and yoga, so slowly, gradually keep on increasing your goals. Gradually start strength training and weight training exercise, obviously with a coach, or these days there are so many online options as well. So automatically this reduces stress. Person will have a good sleep as well. Okay, so these are the important factors. Controlling sugar, you asked if one gets diabetes, then certainly, if you get diabetes, then you have to control your sugar levels and calorie levels. If one is diabetic, one should not miss a meal, because if you are taking a medicine, you should definitely take a healthy, protein rich diet. And regular checkup, as in retina, eyes, heart checkup, kidney, is very important. Controlling your blood pressure. Once you have the diabetes, the lifestyle diseases not only bring diabetes, they also bring high cholesterol, they also bring high blood pressure. So regular monitoring, once in 3 months with your physician, that is very much important. Reducing alcohol, reducing caffeine, all these factors will help.
Great. I think these insights will really help our audience also. And as a team, we are getting great insights out there. So we will be moving to the next session in just 30 seconds. And the session would be more about uh, risk management, when you are suffering from diabetes. And we'll be taking a few questions from the audience as well. So stay tuned with us. Stay tuned with Have Me. And we'll be right back after 20 seconds.